let's say we have exhausted all the chances of treating our pain at the lower back, and we have an option of doing an epidural injection. Well, team management will also have options to you to do other than epidural injection, which is a zygopophyseal joint radiofrequency ablation. You don't have to know that, but the bottom line, that's what you need to understand, that you need to understand that based on a chiropractic nutshell, okay, chiropractic medicine nutshell, that is given the privileges and authorization to treat lower back and musculoskeletal issues and neck pain, that there are satellites that are around those facets, the pillars that hold one vertebra on the top of each other. There is a satellite, okay, and the satellite starts to fire, and when it fires, it sends some information into the brain, tells something wrong in that area. The brain will send back in response, muscle guard the whole thing. Muscle guard. When you muscle guard, that's why you feel the pain in the lower back and the middle back as well. And sometimes it goes down into the buttock, hip, and legs. Okay? It's all muscle spasm. What I am saying here, what I'm trying to say in here, that patients who had undergone for epidural injection, okay, as a last resort for them to resolve their lower back pain, instead of having 2-3 sessions in 1 month, they should have, like, let's say, 1 session of epidural injection and 1 session of radiofrequency ablation, which is inserting a wire, just the same thing as a needle, but not toward this bubble right over here, toward this right over here, where the facet. Okay, I hope you can see it. It's like an ear, the ear. You see the ear right over here? Okay, they insert right over there a wire, and they electrocute it. And when they electrocute it, they will stop the whole firing of the satellite. Okay? That's physical medicine and rehabilitation admitted that. Internal medicine admitted that. Chiropractic philosophy based on this, that's more than enough. So, okay, let's say we have a problem. The disc is pushing on the nerve and is giving impingement on the nerve, okay, as it could be proved with MRI. So the person, once the person deciding to go for pain management, will have to undergo for MRI, magnetic resonance imaging. In addition to that, we'll have to, we're going to go back to our slide, we're going to have to go for nerve conduction velocity test, which is invasive, that they need to measure the velocity or the electricity along the nerve, okay, that is innervating the nerve that comes from the nerve root, from the spinal cord, and giving branches like a tree to all the muscles and all the our hands, arms, and legs, okay, and they have to go for electromyography, EMG, that inserting a needle to determine which nerve is impinged, then to undergo for epidural injection. Okay, so all of that got to happen. MRI, NCV, and EMG, okay, and maybe another MRI, because the operator or the physical medicine rehabilitation doctor or the anesthesiologist or the orthopedic surgeon or the neurosurgeon is not satisfied with this imaging, so they will send for another imaging of MRI. Then you will have epidural. But to me, to my opinion, if you think that this right over there, that the damaged structure of the disc is giving the pain, which I don't think so, because the disc is avascular. What does that mean? Is avascular, lack of blood supply. So that means it dries up within 48 hours. If you have a disc injury, it dries up within 48 hours. The problem is not in here. The problem is the approximation of both vertebrae together. Okay, it gives approximation, and the bones start to friction on the other one, on the adjacent one. Okay, that is the problem. But what you have to understand, that if we have a degenerative joint disease, the osteoarthritis, this is something that goes on for months to develop. Okay, it doesn't go all of a sudden. If your last resort, again, if your last resort is epidural injection, I would say do one session of epidural, and let's do one session of radiofrequency ablation, the one for electrocution of the pillars, of the satellites, that gives the pain. That chiropractic, physical medicine, rehabilitation, internal medicine, all medicine agrees that this is a cause of pain. While we don't combine it, we're just going to hit on epidural. Epidural injection is explained to you. Is a needle introduced right into the bubble, what I said, right into the bubble space, right over here. It's introduced right over here, and that needle, that injection has both in it. Has anesthetic, not a lidocaine, because the lidocaine is really have a very short half-life. They use something heavier. They use anesthetic that can live in the body for a longer time, and they use a corticosteroid along with it, and they inject it into that space where the bubble is at. Sorry, I'm gonna get back to it for a second. They inject it right into the space right over here. They inject it right in here, right into the space. Well, actually, they inject it into here, and they might ask you to come up like 2 weeks later or a week after to do another injection in another level, and then another level. Well, that is as expected, because it's right next to the meninges, which is the envelope of the spinal cord, and can irritate. So at this time, at this present time, we see an epidemic meningitis, and it's caused by pharmaceutical. Well, to my personal opinion, let's get, really technical on the technicality of it. Where is it happening? Who's the operator? The sterility? Before we get into the corticosteroid, I'm not representing any pharmaceutical company at this time. I'm not representing anybody. I'm just doing a wellness program. But I am just saying, let's check out who's the operator, where did it happen, is it in an operating room, is it in the right environment, is it in the right injection. It's all of that got to be investigated before to come up into a conclusion. Okay, that's not a compounding. A corticosteroid is anti-inflammatory, has been in the market for decades, has saved my life, because when I was young I had an asthma. People got an asthma right now, and think what? Guess what? They get better on corticosteroid, anti-inflammatory, because it's very strong anti-inflammatory. So we can't say that a corticosteroid can cause meningitis. No. I think if somebody would have the last resort to do and want to do an epidural injection, instead of injecting it into there, take it as a packet. There is a pharmaceutical right now that offering corticosteroids added dosages. Start from 30, then 25, then 20, over a 10 days period of time, and you take it orally. I understand that it could be faster if you inject it, but it would be better and safer if you have it oral tablets, and will give the same effect. But the only difference that here is injected right into the place, the corticosteroid. There, you just take it via oral and tablets under the supervision of a doctor. That's the only difference. Okay? And the lidocaine, it will have to be used because they're introducing an injection into your body. The reason people feel very sore and very bad and a lot of muscle spasm, because again, that needle will have to go through the skin, muscle, tissues, ligaments, down there, right into the bubble. Okay? So we're talking about a very big depth. Okay? And to be injected. Well, it happened, I've seen it, I witnessed it, that as soon as they get a fluid back into the syringe, they just shoot it right away. They know that they are in the right place. But right now, they use a fluoroscopy. Fluoroscopy is like a video, can show you right the inside structure on the video. Just like you see me right now, they can see inside your organs very clearly. And they introduce that needle. So it cannot be a mistake in there. Going back to our discussion, okay, avoiding the unnecessary things. So trigger point injection, I really don't understand up to the present time, with all respect to the colleagues, all respect to the medical doctors, all respect to the doctor of osteopath, to everyone, to any field. I really don't understand what's the rationale behind injecting a trigger point that we really don't know, other than a muscle spasm, injecting a muscle with whether a lidocaine you put like anesthetic or a corticosteroid with an injection. I really have no idea. I got no knowledge. All what I know, Dr. Travell, who founded the trigger point, who explained about the trigger point, and who made a series of videos that I have it in my possession, and showed us how to stretch the muscle and get rid of those trigger points. But injecting it, causing a muscle trauma, injecting a trigger point for no reason, for you to know it will cause more pain. Pain will be more and more exacerbated. The reason why, when somebody has a low back pain, okay, you feel it sometimes, you feel it going down to your legs. You say, oh my God, this is very bad pain. But let me tell you something. You don't know, it has not been proven up to the present time. That is a very big challenging field, challenging issue in the medical field, that whether the pain comes from the nerve root, from the spinal cord nerve root, or comes from the nerve endings of the muscle that is innervated. So you really don't know. You don't know where is the pain comes from. Okay? You don't know. The muscle goes to the lower extremities, goes down to the legs, or goes down to the arms if you have a neck pain. You really don't know where this pain comes from. Is it myotomal? Is from the muscle? Because it would give the same thing as a nerve impingement in here. And I don't think one nerve impingement will give all that symptomology right over there. It's just give it right along one strain. One little. This is C5, C6. It will give you just one. It will not give you the whole hand to be numb, tingling, paresthesia. That means pins and needles. It will not give you that. You will not have this. Surgery is really the last resort that you will ever want to think about doing. Okay? Spinal surgeries are not really recommended unless there are muscle weakness, incontinence, urinary incontinence, you know, you cannot feel what you're doing, fecal incontinence, weakness, you will know that this is an indication for surgery. Otherwise, it's not recommended. Moving forward, lower back pain treatment. How I would treat it? Well, pain medication and anti-inflammatories such as Advil, okay, that in synergy with Tylenol. Advil is an anti-inflammatory, or ibuprofen, okay, which comes Advil, ibuprofen, Motrin. Ibuprofen is the active ingredients. It should really be prescribed by the supervision of a primary care physician. So you need, up on having a lower back pain, you need to get contact with your family physician and let her or him know about the situation and if you can take those medications and what type of anti-inflammatories that would be recommended or prescribed by the physician. And sometimes some doctors really would give a Tylenol with it, and you wonder, why is it Tylenol? I don't have a fever. Well, Tylenol is just as a for pain inhibitor in your brain. Or sometimes they give Tylenol with a low dosage of opioid. Okay? So this is something for you to help you out to go on with your stretching. Stretching your buttock muscles, I'm going to show you stretching the hamstrings muscle, hamstrings, and using pillows between the thighs at night time. And above all of them is heat. Heat shown to be the most effective modality for treating lower back pain. The most effective one. Okay? And if you have a hot, moist back, heat, it has to be separated from your skin by 6 layers of towels. Okay? In addition to that, a pain medication that could be taken for about a week or so, or 2 weeks, 10 days, as your physician deemed to be appropriate. Stretching the buttock muscles and the hamstrings. I'm going to show you a demonstration of that. That would help you out a lot in your practical life. And really, if you follow this, you would appreciate it. Even after having an epidural, you need to continue with your conservative treatment, stretching, physical therapy, chiropractic, whatever you choose, okay, to do. And you need to prevent this severe episode of lower back pain from recurrence, okay? And it's very easy. Stretching the buttock muscles can give you a spontaneous relief, okay? For somebody who's skinny like me, it's easy. You can do like that, cross your leg on the top of the other one and raise it up at the beginning. At the beginning, you do it like this. Do you feel any pain now? You do like this. You raise up the other one and you do like that. You feel it. You will feel some pain going sharp down from the hip to the buttock region. And keep breathing throughout this exercise. Please keep breathing as much as you can tolerate. You can wait for 15 seconds. Say, oh my God, this is so sore, so bad. And then you put it down and you do it to the other side. If somebody has a problem with the knees, cannot do this, you can easily do this and lay back and just do like that. It's very easy. The curve of the lower back that is a little bit in the front, you can really reverse it and you stretch your muscles at the same time. Okay? That's shown to be very helpful and gives a spontaneous relief. Very helpful. Caregiver can do this. You can do also like that. You can, as you're sitting down, every 2 hours, you can take 15 minutes break, and then you cross one leg on the top of each other, and you bend forward like that. And when you bend forward, you feel the pain going down into your leg and hip. Don't worry. And then you put it back. And then you do the same thing. You do it like that. Ask your physician if you can do this exercises, because some people got a hip problems and a knee problems. But the heat is always indicated, unless if there is a wound, you cannot apply it. Your primary care physician or your nurse or physical therapy will guide, the physical therapist will guide you to do this. After you do the buttock muscles, you're stretching your hamstrings. Stretching hamstrings is very easy. It's just as if you're laying down like that, the caregiver can do like, you know, can stabilize one leg and stretch the other one. Okay? Open your tolerance. You keep breathing as you're doing it. Please do not hold your breath. Those are very important things. As if you take your medications and you stretch your buttock muscles, you're stretching your hamstrings, you're using a pillow between your thighs as you sleep, and the affected side, if you have a lower back pain on the right, you sleep and you sleep on your side, on the left side, and the right side is up and the pillow in between your thighs. Okay? That's very important. That's very important to do. then the pain will get down and decrease in intensity. Keep stretching your buttock muscles and hamstrings muscles all the time, please. You can avoid lower back pain occurrence. How to use a heating pad. Never lie on a heating pad. Let the heating pad lie on you, otherwise you can burn your skin. The skin can be burned. Always use 6 layers of towels between a pad and the skin. Well, this is what the protocols say. If you're using a hot moist pack, like the one that's the traditional one, heating pad, the traditional one, not the electrical one, the heating pad, it should have 6 layers of towels. If using the electrical ones, put about 3 layers of towels and keep it low, please, and give that heat for 15 minutes. And be careful not to get burned. Okay? Skin burning can cause damages. Low heat is the best. No more than 10 to 15 minutes. Okay? You can do it 3 times a day. What is in your back pocket? A lot of people comes in with a back pocket like this, that thickness, and they put it in here. Or they lay on one side. That's a bad posture. That's a bad habit. Okay? That back pockets can give you severe back pain. Cell phones, putting in here, use it. I can tell you something. I bet you with this. I can take off one shoes of mine. I keep the other. I can take a walk in here for 10 minutes. I'll come back. I sit down. I will have a severe back pain. I bet you with this. Try it on your own and you'll believe me. That's called a postural imbalance. The kinetic chain of your body will get broken. Because our body, as you saw, the muscle, the ligament, the bone, and everything is all put together. Okay? It's a close kinetic chain. Anything happen, the whole 9 yards will get destroyed. Okay? People who got a back pockets, they get pain up going to the neck. No cell phones, no cigarettes, no wallet in the back pockets. It should be flat. If you want to have, you can have your wallet in the front. What's in your feet? Well, to my experience, sneakers are the best, and orthotics are good as well. Just make sure that you use a good shoes. Okay? There are sometimes you buy shoes that is nice, but you take a walk with it, you just come back with severe back pain. Think about it. Sometimes this is the problem. Cushion that seat. Use a lumbar cushion or support the lower spine. There is cushioning, okay, to cushion your lower back. You can put it on the seat as you sit down in your office. You sit down, you're doing whatever you're doing. There is something, it's called a lumbar cushion. It's affordable. You know, that's an ergonomics. You need, you know, heated cushions are the best. You know, the ones that cushions and that has a heat is the best. Avoid heavy pocketbooks, satchels, and backpacks. Avoid that. It has no reason. I mean, put it in on your back. No, you can do it just only for like a little while, but don't keep doing it. Always bend your knees and your leg muscles to lift, especially for shoveling or snow. So use your, right over here, when you want to do something, use your legs. Use your muscles of the legs. Use your muscles, the quads, right over here. As you get an age, you know, I would advise you the best. People do not end up in a wheelchair if they would do the following. Sometimes we feel weakness of our lower extremities, of our legs. What we can do? You know what you can do? It's very easy. You can do something very good for your knee, for both knees, okay? That you can apply something, a heavy pressure on your foot and raise it up and get it down. Raise it up, get it down. Raise it up and get it down. And do the same thing. Even you can use a rubber band that, you know, just draw it like that, draw it like this. And you will see that this muscle is getting strengthened. You know, you're strengthening your quad muscles. Stretch your arms. Do not twist. When you do like that, you do like this, like that, like this, like this. The reason why, because when I showed you the second picture in here, okay, when I showed you this second picture in here, after this, and I showed you the muscles, there is a muscle that's called a latissimus dorsi muscle. Latissimus dorsi muscle is the #1 overlooked muscles around the medical field. It goes on the top, there is an upper trap. There is down here, there is one muscle that wraps around your body and inserts right over here on the buttock region. So if you lift your arm up, put it behind your back, and do like that, do like this, all right? Do like this, and sometimes you want to do like that, you will get all the pain off your middle back and lower back. Okay? That's the most overlooked muscles in a clinical setting, and according to Dr. Travell, especially among females. They experience a middle back pain that nobody can take it out. No one. And guess what? It's just only a muscle. It's like a blanket. Spinal discs is usually not required. Surgery is usually not required to remove a spinal disc. There are a lot of techniques that have been going on in the market. Discectomy to remove the disc out without opening, without surgery. Never worked. It never worked. What are you going to fill up instead? But again, I give all the respect for those doctors. They have their own point of views too. But it's just not working. On a clinical setting, when they come to rehab, it's not working. Gentle care, stretching, and all the above discussed. When you stretch your buttock muscles, hamstrings muscles, arms, for the latissimus dorsi, heating pad, using the orthotics, lumbar support. Lumbar support, you use it when you have a severe pain, but again, you have to take it out every 2-3 hours and you move. You have to move. You got to move. Okay? And when you move like that, you move like this, you bend forward, don't worry, nothing is going to happen to you. Okay? You're just going to increase on the function, on the way how do you move your spine. Is the best. But surgery is not well recommended unless there are other warning signs. Weakness, severe weakness, the muscle gets smaller, urinary incontinence, there is urine, leaking of urine, or fecal incontinence, that's when the surgery is indicated. Yes. Any others? No. Lower back pain and exercises. Swimming in warm water is beautiful. It's very well recommended because the water will make you, is a non-weight bearing. You can move inside the water. Okay? Water aerobics is called. Williams flexion exercises. Williams flexion exercises is very important. This is an exercise that they teach it to the students in school, but unfortunately, students are not taught that if the muscle is not stretched, cannot be strengthened. So first you have to be stretched, good, have energy, then you can be strengthened. Okay? After you stretch all the muscles that I told you, and you stretch your back muscles, then you can strengthen it by visualizing a rod that going through from your hip into here, from one hip into another, and you want to flip that rod, okay? Just like that. Or you can find two bony prominences in here, put your thumbs on it, and then what you do is you gotta keep breathing throughout this. What you do is just, you gotta move that. For 10 seconds. This is called also a Kegel's exercises that they teach it to females after pregnancy. Okay, I don't know why they call it, but anyway. How do you know you're doing it right? You're doing it right when you are laying down, you can do the same thing. You feel that right over here, when you're laying down on a table, the lower back will be flat or squeezing on your fingers. If you put your fingers down, it will be squeezing. Your lower back will be squeezing on your fingers. And your buttock muscles will be tighter. That's how you stay. It's called a spinal stabilization. You stabilize your lower back by strengthening the abdominal muscles and stretching the lower back muscles. And that's how you get into healthy shape. So again, Williams flexion exercise is happening after stretching. That's when you strengthen your abdominal muscles. Okay? And you just do it like this. Now with your legs, with your abdominal muscles, it's right over here, like that. Ask your therapist or a chiro to help you out. Or a chiro to help you out how to do those exercises. It's called Williams flexion exercises. Massage. Deep soft tissue massage of the hips and the upper buttock help a lot. Avoid pressure on the sciatic nerve. How do you know that? Okay, it's very easy. If I have severe back pain and I know I have it, you know what I would do? It's just easy. I can do it on my own. I just, stand like here or sit down on one side, and all what I have to do is just go up higher in here and I see bony prominences and just go push pressure. Put a lot of pressure in here and push down in here, push down, push down, push down. This is the same muscle that you're stretching and giving you a lot of back pain. And here, on the hip also. But avoid one spot. It's right over here. The spot that goes from the hip, right over here, across the buttock. This is where the sciatic nerve goes through. Right over here. It goes right through. Right in the middle. Okay, so you got to avoid putting that. Just only on the bony prominences on the back, you go deep, soft tissue massage. Along with the heat, it will take off your pain. Avoid pressure on the sciatic nerve. I told you where the sciatic nerve goes. Goes from the hip right into the middle of the buttock. You can move your leg like this and you feel the hip. This is the hip. This is the hip. Put your finger in here and go straight and across the buttock, and you will know right in the middle there will be sciatic nerve. Avoid that area. Even the injections, that's how the nurse will know to avoid that area. Will go above that line. Weight loss. Losing weight and maintaining a healthy diet can help with lower back pain. Sometimes you might need a registered dietitian. It's not bad to pursue a registered dietitianist help, a multidisciplinary help. They can, you can tell them that I have arthritis or this injury and pain, so they can give you supplements that is enriched with anti-inflammatory. So that's losing weight and a healthy diet, but it's an enhancement. It's not like losing weight like pounds and pounds and pounds. No. Just under strict supervision. Middle back pain, usually pain radiating from the lower back or the neck. It's never been the cause, unless if you have a gallbladder stones, a cholelithiasis, it will give you a middle back pain. So middle back pain alone cannot be. It's either radiating pain from the neck or the lower back, because the middle back, as I showed you, is you have a curve backwards. We were born with that. It's very rigid. The middle back is very rigid. Okay? So, no structures could be damaged in there. And believe it or not, at 30 years of age, you take an x-ray of a middle back, it will show osteoarthritis. And that's normal. And that's a negative x-ray.